So one thing I'd like to mention is that I get quite a lot of questions from nurses and techs about how do I take my newfound knowledge back to my practice and feel heard, or indeed get heard by the surrounding veterinarians. It's a great question, because often nurses are doing the majority of anaesthesia and pain management in practice. So their knowledge and skill set is really well practiced and honed, and maybe the veterinarians around you are quietly relying on you, and potentially there's a take for granted in there without even realizing there's no bad intent here. So that when you come back in and you say, hey, this is the way to do it, or I learned this, it can sometimes challenge the standpoint of the veterinarian and not be in the best interests of the patient. So it can be a bit of a tricky situation. So at the end of this course, we want you to be really confident in your knowledge and skill set so that you can collaborate with the veterinarian that is supervising you.